My name is, so thank you so much for that introduction, Ma'am Trisha. No, so my name is Carl John Paul Algailoa. I graduated Bachelor of Science in Nursing from Xavier University Ateneo de Cagayan, and I passed the board exam on June 2019. And thankfully, I also landed top 9 in the PNLE 2019. And I do believe that the next board top notcher is in your batch. Okay? Kayang-kaya? Ay, naturuan na ba kayo sa catchphrase ng PEAK? Ito ha, when I say kayang-kaya, sasabihin yung walang duda. Kayang-kaya?
Walang duda.
Yan, walang duda.
Kayang-kaya.
Ayan. So as what Ma'am Trisha mentioned a while ago, so recently lang talaga I had my lecture on Fundamentals of Nursing in Butuan City. So buti na lang may rest day ako kahapon. So yeah. I've been teaching Peak Excellence Review Center since 2019, and I just accept schedules whenever I'm free. And I usually teach Fundamentals of Nursing, Palmer, that's your professional adjustment, leadership and management, ethics and research, and I also teach medical surgical nursing. Now, so currently I'm studying Doctor of Medicine in Mindanao State University College of Medicine. So ayan. So siguro something more about me. I also experienced working in the hospital. So I was assigned in the ICU, intensive care unit, before I proceeded to medicine. So ayan, are you guys ready? Hello?
Yes, sir.
Ready na. So before I start, I'd like to ask, how is the pre-test? Can you rate its difficulty from 1 to 10, with 10 being the most difficult? Kamusta yung pre-test natin?
10, sir.
10. Yes, okay. That's already an expected answer, no? Because for the longest run, in my experience in teaching in Peak Excellence Review Center, all of my students would always say 10 over 10 talaga ang pre-test. Ganun talaga yan sa Peak. Bagong pasok pa lang, bugbog sarado ka agad sa test. But don't worry, okay, in Peak Excellence Review Center, you would be given lots and lots of questions, because in our dictum, the more questions that you're going to answer, the more chances of passing and topping the board exam. So ganun tayo sa PIC. Mabuti na ang manobra kaysa sa magkulang. Okay? Sige, let's start. So let me share my screen first. Okay. Ayan. So, nakita nyo ba yung screen ko? Is it visible on your end? Hello?
Yes, sir.
Yes, sir.
Yes, sir.
Ayan. Okay, sige. Let's start. Number 1, Nurse Joe is to interview the client as an initial nursing action so that he can do what? So, guys, in the nursing board exam, usually the format of the questionnaire, there's always a situation for every 5 items, usually. So here's my tip to you, okay? So before you answer the questions from 1 to 5, do not forget to read the situation. Because if you're not sure of your answer, you can always go back to the situation and you can find the clue to the specific question in that sentence or paragraph. Nakuha ba? So the situation is Mimi, 45 years old, waiting for her doctor's appointment at a clinic where Nurse Joe works. Now, going back to number 1, okay? Initial nursing action, okay, during the interview. What are you going to do first? Alpha, document important data and her client records for health team to read. Bravo, gather data about your lifestyle, health needs, and problems to develop a plan of care. Charlie, provide solutions to her immediate health concern. Or Delta, identify the most appropriate nurse diagnosis for her problem. Now, to be able to answer number 1, do not forget, okay, our nursing process. Okay, nurses, ano nga yung nursing process natin? What's the mnemonic?
Yes, sir.
Advisor.
Okay. Sige, ano yung una sa ADPI?
Assessment.
Okay, what's next?
Nursing diagnosis, sir.
Ano yan?
Nursing diagnosis.
Very good, ha? Nursing diagnosis. Huwag kayong sasagot ng diagnosis lang kasi maraming klase-klaseng diagnosis sa buong mundo. It should be nursing diagnosis. Okay, at least I know that you should answer nursing diagnosis. Guys, Kaya yung ano ko, I would prefer the mnemonic to be and pi instead of add pi. Okay, now, let's go back to number 1. What should be the first action of the nurse based on the nursing process? It should be, number 1, obviously, it should be bravo. Gather the data first. Can you just imagine, Alpha, document important data, wala ka, di ka pa nagtatanong. No? Charlie, mag-intervene ka na, hindi mo pa nga alam niya anong problema niya. And look at Delta. How would you be able to formulate your nursing diagnosis without doing first your assessment? So the best answer, number 1, it's bravo. Okay? Sige. Guys, can you chat or interrupt me if on your end I'm choppy? Okay lang ba sa inyo? So far,
Okay,
choppy
sir.
ba ako? Hindi.
Hindi, sir. Liman, sir.
Hindi naman choppy. Okay, very good. Sige. So, yun. Sige, so number 2. During the interview, Mimi experiences a sharp abdominal pain on the right side of her abdomen. She further tells Nurse Joe that an hour ago, she ate fatty food. Okay ha? Keyword, fatty food. And this has happened many times before. The nurse will record this as what? Okay ha? Again ha, yung keyword natin, ate fatty food, tells Nurse Joe that an hour ago. Okay ha? Ate fatty food. Ano yung natin? Ano yung subjective data natin? Sharp abdominal pain on the right side of her abdomen. So, how would you record this? Look at Alpha. Client complains of intermittent abdominal pain an hour after eating fatty foods. Bravo. After eating fatty food, the client experienced severe abdominal pain. Charlie. Client claims to have sharp abdominal pains after eating fatty food unrelieved by pain medication. Or Delta. Client reported sharp abdominal pain on the right upper quadrant an hour after ingestion of the fatty food. Now, obviously, between Alpha, Bravo, Charlie, and Delta, which do you think is the most accurate documentation? Now, look at Alpha. Complaints of intermittent abdominal pain an hour after eating fatty food. So, nandun tayo, tama yung an hour after eating fatty foods. But, if you're going to go back to the initial data, intermittent abdominal pain, is that complete? Is that a complete documentation? Na-specify ba yung location? Hindi. So, eliminate Alpha.
Hindi.
Okay, very good. Bravo. After eating fatty food, the client experienced severe abdominal pain. Hindi na-specify yung location, hindi rin na-specify kung how many hours after eating fatty food. Tama ba? So, eliminate Bravo. So, between Charlie and Delta, which do you think is the better answer?
Delta, sir.
Very good. It should be Delta. So number 2, it's Delta. Now, before we proceed, I'd like to acknowledge the presence of Dean Madeleine Zamaila. So welcome to Peak Essence Review Center, Ma'am Dean. Ayan. So number 3, Mimi tells the nurse that she has been on high protein, high fat, and low carbohydrate diet or in order to lose weight, and that she has successfully lost 8 pounds during the past 2 weeks. In planning a healthy, balanced diet for her, Nurse Joe will do what? Okay? What are you going to plan for your client? Alpha, encourage her to eat a well-balanced diet with a variety of food from major food groups and take plenty of fluids. Bravo, ask her to shift to a macrobiotic diet rich in complex carbohydrates. Charlie, encourage her to cleanse her body toxins by changing a vegetarian diet with regular exercise. Or Delta, encourage her to eat high carbohydrate, low protein diet and low fat diet. Okay, so number 3, best answer. Okay, so again, going back to the question, being on high protein, high fat diet, low carb in order to lose weight. Okay, so the best answer here is what? Alpha, Bravo, Charlie, or Delta? Ano answer nyo?
Alpha.
Yeah. Ito nga, klarong-klaro. Best answer according to Kosher and Herb 8th edition, it's Alpha. Okay, Alpha. Well-balanced diet with a variety of food from major food groups. Okay, very good. So best answer number 3, Alpha. Nurses, may I ask, what book are you using for your fundamentals of nursing? Are you still using Kosher and Herb? Or Potter and Terry na kayo?
Kosher.
Kosher kayo.
Kosher,
Okay,
Japan,
Kosher
sir.
kayo. Kayo na batch. Okay, very good. Sige. At least we're on the same page. Sige, for a while lang, ha? Ay, ba't ayaw mag-down? Ayan. Sige, number 4. Nurse Joe learns that Mimi drinks 5 to 8 cups of coffee a day plus cola drinks. Because she is in her premenopausal years, the nurse instructs her to decrease the consumption of coffee and cola preparation because it does what? Alpha. These products increase calcium loss from bones. Bravo. These products have a stimulant effect on the body. Charlie. These products encourage increase in sugar consumption. Or Delta. These products are addicting. Okay? So what is the effect, okay, of your cola drinks and coffee? Okay, remember nurses. Okay? Usually females have an increased risk for calcium loss, especially if postmenopausal. Okay? That is why if you notice, postmenopausal women are actually encouraged to drink calcium supplements. That is to prevent the occurrence of the loss of bone density. What do you call that disease wherein there's a loss of bone density? Anong tawag doon? Osteoporosis. Very good. Now, based on that knowledge, which do you think is the best answer for number 4? It is alpha. Okay, alpha, because these products increase calcium loss from the bones. Best answer number 4, it's alpha. Now, let's look at number 5. Health education plan for Mimi stresses the prevention of non-communicable diseases that are influenced by lifestyle. These include the following, except for what? Alin dyan yung hindi included sa lifestyle diseases? Is it alpha, cancer, bravo, diabetes mellitus, Charlie, osteoporosis, or delta, cardiovascular diseases? Number 5, best answer. Again, health education stresses the prevention of NCD or non-communicable diseases that are influenced by lifestyle. Best answer in number 5 should be what? Ala. Okay. Ito, nakita ko kasi maraming students usually nalilito sa question na to. Okay? Some would answer osteoporosis. Kasi di ba yung kanina, because this osteoporosis nalilito yung students because yung osteoporosis is usually attributed to the increased risk factors of women. No? However, if you have a sedentary lifestyle, okay, you do not exercise much, you're just at home, sitting pretty, parang couch potato, that can also lead to osteoporosis. Or worse, it could also lead to osteoarthritis, okay? So, your osteoporosis is still influenced by lifestyle because your exercise can help increase your bone calcium deposition in your bone, thus helping strengthen its integrity. Now, so kung hindi naman best answer osteoporosis, the best answer, ito, yung nami-miss out ng students, the best answer is bravo, diabetes mellitus. Okay. Sir, bakit diabetes mellitus? Di ba ang daming mga lifestyle, mga ang tawag nito, nag-a-abuse ng lifestyle, puro DM, type 2, di ba? Pero, tanong ko sa inyo, na-specify ba sa bravo na diabetes mellitus ba? Hindi. Okay? Remember that your diabetes mellitus 1, okay, your DM1 is not lifestyle related. Okay, it is due to an autoimmune process which destroys your what? Destroys your anong part ng pancreas? The islet of Langerhans. Okay, the islet of Langerhans or the beta cells. No, that is why nababawasan na yung level of insulin, leading to diabetes mellitus type 1. So remember, hindi naka-specify na diabetes mellitus yung bravo. Okay? Hindi siya naka-specify na DM type 2. Okay? Kasi hindi lifestyle related yung DM type 1. Best answer number 5, it's your bravo, diabetes mellitus. Okay? So, okay ba? Naintindihan ba?
Yes, sir.
Okay.
Yes, sir.
Very tricky, no? Medyo tricky. Okay? Medyo tricky yung natin. Okay, sige. So, number 6. Okay Ang situation natin, we are in the operating room. Okay? Number 6. The sterile nurse or sterile personnel touch only sterile supplies and instruments. When there is a need for a sterile supply, which is not in the sterile field, who hands out these items by opening its outer cover? Number one, look at Delta. Is it the nursing aid ba? Ay ano natin? Hindi. Remember, your nursing aid is there to assist the nurse, especially in vital signs taking. That's not one of the responsibilities. Handling your sterile field, no? Eliminate Delta. Do you ask? Look at Bravo ito. Uutusan mo ba yung anesthesiologist na kukuha ng sterile supply? Sige nga. Would you dare ask the anesthesiologist, Doc, pakikuha nga ng NSS, pakipour dyan sa natin, sterile basin? Or can you ask the anesthesiologist, pakiabot nga ng extra natin na forceps? You do not do that, ha? Remember, the role of your anesthesiologist is what? Ano yung title ng anesthesiologist natin in the operating room? If the surgeon is the captain of the ship, okay, ano yung role ni anesthesiologist? The anesthesiologist is actually the guardian of the patient, tagabantay, making sure that the client will survive the surgery, no? Especially by introducing anesthesia and by monitoring the client's response to anesthesia. Hindi sila ang taga-abot ng sterile supply. Eliminate Bravo. Best answer, is it Alpha circulating or Charlie scrub nurse?
Alpha, sir.
Circulating
Alpha,
nurse.
sir.
Circulating nurse. Okay? Guys ha, huwag niyong kakalimutan, the title of the anesthesiologist is the guardian of the patient. No, I noticed for how many years students often forget that title. No, usually pag tinatanong na sa exam hindi na makasagot. Okay? Sige, additional input ko lang yun for this item. Best answer number 6, it's Alpha, circulating nurse. Okay? Circulating nurse. Number 7, performs distinct rule for one surgical procedure to be accomplished within a prescribed time frame and to deliver a standard patient outcome. While the surgeon performs the surgical procedure, who monitors the status of the client like urine output or blood loss? Best answer in number 7. Kasasabi ko lang kanina, sino yung guardian ng patient? Who is the guardian of the patient? Very good. It's the anesthesiologist, Charlie. Best answer number 7, it's Charlie. Number 8, surgery schedules are communicated to the OR usually a day prior to the procedure by the nurse of the floor or ward where the patient is confined. For orthopedic cases, what department or which department is usually informed to be present in the OR? Okay, keyword natin, orthopedic cases to be specific. Best answer in number 8. Ayan. So remember, where there are orthopedic cases, where there are bones, in order to visualize them, what do we need? Mga radioactive imaging tools. So sino yung tatawagin natin?
Radiology.
Very good. It's the radiology department. Best answer number 8, Delta. Now, ito, additional ko na question. You already have contacted the radiology department. What else should you ensure that should be present inside the OR so that you will be protected from the radioactive beams? Okay, sige nga. Ano yon? What do we call that gown? That's yung armor na sinusuot pag nag-x-ray. It is the lead gown. Okay ha? Nurses, always remember lead gown. Wag na wag kayong papayag, okay? Nandiyan kayo sa OR, mag-x-ray sila tapos wala kayong protective equipment, okay? Remember, we are healthcare workers, okay? Although that the single exposure from radiation will not cause significant effect, no? Yung radiation coming from the x-ray, it's not going to cause a significant effect if single exposure lang. But remember, we are healthcare workers and we are likely to be exposed on a daily basis. And that can be dangerous, okay? And that can lead to deleterious effects. You can have cancer, sterility, etc. That's why personal protective equipment, especially during x-ray, no? Ang PPE natin na ginagamit, it's your lead gown, okay? It's very important. Number 8, best answer, Delta. Anong number na ba tayo? Number 9. While team effort is needed in the OR for efficient and quality patient care delivery, we should limit the number of people in the room for infection control. Who comprise this team? Obviously, best answer in number 9, it's the Bravo. Okay, surgeon, assistants, scrub nurse, circulating, and anesthesiologist. Best answer number 9, Bravo, obviously. Ayan. Number 10, in massive blood loss, prompt replacement of compatible blood is crucial. What department or which department needs to be alerted to coordinate closely with the patient's family for immediate blood component therapy? Look at Bravo. Tatawagin ba natin chaplaincy? 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 Okay, tatawagin ba natin si Father to pray for the patient? To kailangan ng dugo? Pray for the patient na nadadami lang yung production ng red blood cells niya? Of course, obviously, no. Okay? The focus of the chaplaincy is for spiritual services. Okay? So eliminate Bravo. Would we call Alpha Security Division? Security Division. Okay, tatawagin ba natin? Ano may tutulong ni guard, manong guard, or ng head security? If kailangan ba ng blood component, remember, from the word itself, security, meaning they will ensure the safety of everyone in the hospital. But providing blood, okay, for emergency cases is beyond their scope of practice. So eliminate Alpha. So between Charlie and Delta, best answer. What's your answer, nurses?
Charlie.
Charlie. Best answer, very good. It's your Charlie, social service section. Bakit hindi yung pathology? Kasi yung pathology department, they're the ones responsible for what? For diagnostics. Okay? Diagnostics din sila. So best answer number 10, that's Charlie, social service section. Number 11. Nurse Hikari is taking care of Takeru, who will undergo TNA in the morning. His mother asked the nurse if Takeru will be put to sleep. Nurse Hikari's teaching will focus on what? Is it Alpha, spinal anesthesia, Bravo, anesthesiologist preference, Charlie, local anesthesia, or Delta, general anesthesia? Now, look at what type of procedure you perform. Tonsillectomy and adenoidectomy. So question, nasaan ba located yung surgery? Is it on the upper part of the body or the lower part? Upper or lower? Number 11.
Upper, sir.
Upper, di ba? Upper. Sige, tatanungin ko kayo. Papayag kayo, natatanggalan kayo ng tonsil, okay? Tatanggalan ka ng tonsil, tapos local anesthesia lang. Sige nga, payag kayo? As patient, do you think that local anesthesia is enough for you during to keep you pain free during this major surgery? Is it enough?
No, sir.
Local anesthesia. Sir, local lang muna tayo kasi nagtitipid tayo. So eliminate Charlie. That's absurd, okay? Remember, tonsillectomy is a major surgery. No, eliminate Charlie. Look at Bravo. Anesthesiologist preference. Okay? Depende sa sir? Depende yan sa anesthesiologist. Kayo na lang mag-usap. Question, is that therapeutic? Pinapasa mo.
No, sir. No, sir.
Eliminate Bravo. Now, look at Alpha. Spinal anesthesia. Again, tatanungin ko kayo, saan nga kayo ooperahan? Diba sa upper part ng body. So nag-spinal anesthesia ka, wala kang maramdaman, you won't be able to feel anything on your lower part, but the surgery is done on your tonsils. So what do you think will happen to the patient? Will the patient be pain-free? Obviously not. Okay? So the best answer, number 11, should be
Delta.
general anesthesia. Okay, very good. In the OR, when you're going to document this, if you notice, when they document general anesthesia, they don't use the term general anesthesia. What you will often see would be JETA. Are you familiar with JETA? Ito yan ha. Pag sinabing JETA, it is general anesthesia via endotracheal tube. Okay? Yan yung ibig sabihin ng JETA. Okay? Sige. So, best answer number 11, it should be Delta. Number 12, Takeru's mother asked Nurse Hikari what food to prepare and give after surgery. Nurse Hikari will appropriately say what? Alpha, balanced diet when fully awake. Bravo, hot soup when awake. Charlie, ice cream when fully awake. Or Delta, soft diet when fully awake. Best answer in number 12 should be what?
Delta, sir.
Okay, very good. Best answer is Delta, soft diet. Sir, why not Charlie ice cream? Di ba yung Charlie, sir, soft din naman yun, di ba? So remember guys, better answer pa rin yung Delta because pag nag-answer ka ng Charlie, ibig sabihin, ice cream na lang palagi yung kakainin niya, no? Nakuha ba niyo nurses? So the best answer here, it's Delta because if sinabi niyo soft diet, then there can be many combinations, food combinations for the client, many more varieties available. Okay, nakuha? Best answer, it's Delta. By the way, may I ask, how would you know if your patient post-tonsillectomy is experiencing hemorrhage? What's this characteristic sign post-tonsillectomy that is indicative of bleeding or hemorrhage? Ano yon? Sige. Ano yan? Frequent what? Frequent? Kahit wala namang iniinom na tubig, laging nagsaswallow. Frequent swallowing. Ha? Nurses, this is very important kasi binabalik-balik ito na question in any type of exam. Okay? Pag may sinabing frequent swallowing post-tonsillectomy, that is indicative of hemorrhage. Okay ha? Tandaan nyo yan. Now, let's proceed to number 13. Maintain post-op TNA client in what position? Best answer in number 13 should be what? According to Brunner and Sudart, it should be bravo. Prone with head on the pillow and turn to the side. Okay, yan yung best position post-tonsillectomy. Number 13, best answer, it's bravo. Number 14, should monitor the client for the most common post-operative complication of what? Is it alpha, hemorrhage, bravo, endotracheal tube perforation, Charlie, oropharyngeal edema, or delta, epiglottis? Remember, look at delta, epiglottis. Is that an abnormality? Epiglottis? Is that abnormal, epiglottis? Guys.
No,
Okay,
sir.
No, sir.
normal. Actually, a name of an anatomical okay, an anatomical part that will prevent you from experiencing what? Aspiration, no? Eliminate delta. Best answer number 14 should be alpha, hemorrhage. Kaya yung sinabi ko kanina, what should be the what's the sign indicative of hemorrhage?
Frequent
Swallowing, sir.
Best answer number 14, it's alpha. Number 15, Takeru is to be discharged in the afternoon of the same day after TNA. Nurse Hikari will make sure that the family knows to do what? Is it alpha? Offer osteorized feeding. Bravo, offer soft foods. Charlie, supplement his diet with vitamin C rich juices. Or Delta, offer clear liquid diet for 3 days to prevent irritation. Best answer number 15, it's bravo. Soft food. Very good. It's bravo. 15, bravo. Ayan. Okay, situation, experiencing left sharp pain, occasional hematuria, was advised to undergo IVP or intravenous pyelogram by her physician. Number 16, Sora was so anxious about the procedure and particularly expressed her low pain threshold. Nursing health instruction will include what? Best answer dito, it's alpha. The pain is associated with the warm sensation during the administration of the HIPAC by IV. Okay ha? Best answer number 16, it's alpha. Number 17, Nurse Tai Chi, monitor and instruct the client and significant others post-IVP. What should be instructed to the family members and to the patient? Number 17, best answer, it's alpha. Delayed allergic reaction. Usually, pag may mga intravenous dye na ini-introduce, always watch out for allergic reaction. Best answer number 17, it's alpha. Number 18, to excrete contrast medium. Instructed the family to include more vegetables in the diet and to do what? So what are you going to do to increase excretion? You should do Decrease fluid intake ba? Or
Increase.
Increase,
very
sir.
Increase
good.
fluid intake, sir.
Best answer number 19. It should be increase fluid intake. Alpha. Number ano nga tayo? Number 20. Ayan. Ay, number 18.
18 pa,
sir.
sir.
18 pa pala. 18 pa. Ay, tama. 19 pa pala.
19,
Sorry.
sir.
18 alpha. So 19. The IVP reveals that Sora has a small renal calculus that can be passed out spontaneously. To increase the chance of passing the stone, you instructed her to force fluids and to do which of the following? Is it alpha, balanced diet, bravo, ambulate more, Charlie, strain all urine, or delta, bed rest? Number 19, what should be done in order to increase the chance of passing out the stone? Best answer, it's actually bravo, to ambulate more. Lakad-lakad muna tayo pag may time, sir. Sir, why not? Charlie, strain all urine. Di ba ginagawa yan if may stone yung client? Remember, straining of the urine will not help you increase the chance of passing the stone. Rather, it will only help you identify the type of stone once the stone has already been passed. It's more of a diagnostic, not an intervention. Okay? So the best answer really in number 19, it's bravo, to ambulate more. Number 19, best answer, bravo. 20. Ayan. Tai Chi, what is that condition where there's a presence of calculi in the urinary tract? The nurse is correct when he answers what? Ang keyword natin, calculi in the urinary tract. Is it alpha, cholelithiasis? Is it cholelithiasis ba? Saan ba yung cholelithiasis? Di ba sa biliary tract yan? So eliminate alpha. Is it bravo, nephrolithiasis, or Charlie, ureterolithiasis? Actually, may point sila because they're still part of the urinary tract. But based on the items or the choices given, the best answer should be delta, urolithiasis. Kasi yan yung broadest definition natin, the broadest term. It will comprise your nephrolithiasis and your ureterolithiasis. Best answer, it should be delta, urolithiasis. 20, delta. 21. Yamato is on a night duty in the surgical ward. One of his patients, Daisuke, is a prisoner who sustained an abdominal gunshot wound. He is being guarded by policemen from the local police unit. During his rounds, he heard a commotion. He saw the policeman trying to hit Daisuke. He asked the policeman why was he trying to hit the patient. The policeman denied the matter. Which among the following activities will Nurse Yamato do first? Alpha, write an accident report. Bravo, call the security officer and report the incident. Charlie, call the nurse supervisor and report the incident. Or Delta, call the physician on duty. Number 21, best answer. Based on the chain of command in the hospital, sino yung unang tatawagin? Sino? It should be your Charlie, chain of command. Yung immediate higher or immediate senior mo, yung dapat una mong tawagin. It should be Charlie. Call your nurse supervisor and report the incident. Best answer number 21, it's Charlie. Nurses, may I ask, did you already have face-to-face classes or purely online kayo? Matanong ko lang.
If lectures are purely online, may but na
Okay.
disclosed ay na exposed na may sa clinical area.
Okay. So kung lecture kayo, online. Pero pag RLE ninyo, face-to-face kayo. You really go to duties.
Yes, sir.
Okay, very good. At least, yung importante dyan, nakakapag-duty kayo face-to-face. Okay? So at least ma-apply nyo yung natutunan nyo sa lectures. No? Sige. So number 23. Ay, no, number 22 pa
22,
pala.
sir.
22 pa. He has 10 patients assigned to him. During his endorsement rounds, he found out that one of his patients was not in bed. The patient next to him informed Nurse Yamato that the patient went home without notifying the nurses. Which among the following will Nurse Yamato do first? Okay ha? Ang keyword natin, 10 patients assigned to him. During the endorsement rounds, He found out that one of the patients is not in bed. So anong gagawin mo una? Alpha, are you going to make an incident report? Bravo, call the security. Charlie, wait for 2 hours. Or Delta, report the incident to your supervisor. Number 22, best answer.
Delta, sir.
Okay ha? Best answer again, report the incident to your supervisor. Delta. Number 22, Delta. Number 23, assigned in the medical ward, he was asked to check the narcotics cabinet. He found out that what is on the record does not tally with the drugs used. So may kulang. So which among the following will Nurse Yamato do first? Alpha, write an incident report. Bravo, keep your findings to yourself. Charlie, report the matter to your supervisor. Delta, find out the endorsement any patient who might have been given narcotics. Best answer in number 23. Ano yung una mong gagawin? It should be Charlie pa rin. Report the matter to your supervisor. Charlie. Number 24. Yamato is on duty in the medical ward. The mother of his patient, who is also a nurse, came running to the nurse's station and informed that her son Ken went into cardiopulmonary arrest. Okay? So what will Nurse Yamato do? Is it Alpha? Start basic life support measures. Bravo. Call for the code. Charlie, bring the crash ito ha, hindi siya crush. Okay? Crash cart to the room. Or Delta, go to see Ken and assess for airway patency and breathing problems. Best answer. Best answer number 24. It should be what? As it Alpha, Bravo, Charlie, or Delta? Number 24. It should be Charlie. Bring the crash cart to the room. So in case na pag man-assess mo, ano pala ito, cardiac arrest. So you can immediately start your life-saving measures, your basic life support or ACLS, depende sa situation. Okay? But usually in the hospital setting, we do ACLS already. So the best answer, number 24, it's Charlie. Number 25, Nurse Yamato is admitting Koshiro at the ward and he found out that the patient is positive for HIV. Which among the following will he do first? Alpha, take note of it and plan to endorse to his next shift. Charlie, write an incident report. Bravo, keep the matter to yourself. Or Delta, report the matter to your head nurse. Best answer number 25 again. Always report your immediate senior. Very good. Delta, report the matter to your head nurse. Sige, at 25, kamusta ang scores natin? Okay, sige, tahimik sila. Let's move on. Number 26, best answer, it's Alpha. Okay, Alpha. Wait. Yes, it's Alpha. Hindi kasali, it's your culture. This is according to Lydia Hall, Care Cure Coordination. Sana ba tayo? Number 27. 26, best answer, Alpha. Number 27, for patients with the following patients should be given the first priority. Now, what should be the basis of our prioritization? Nurses, it should be the ABCs of life. What are the ABCs of life? Sige nga, ano nga yung ABCs of life?
Airway, breathing,
Airway, very good.
breathing, circulation.
circulation.
Airway, breathing, and circulation. Now, based on that theory, which will be the priority patient here? Is it Alpha, terminally ill with breast cancer? Bravo, previously lucid but now unarousable? Charlie, newly admitted and scheduled for executive checkup? Or Delta, cholelithiasis and for operation on call? Best answer in number 27 should be what? Based on the ABCs of life, it should be Bravo, unarousable. Very good. So bakit sir, ang layo naman, neuro na patient, unarousable. Anong connection yan sa airway? Remember, when you are unconscious, you have an ineffective airway clearance. You are at increased risk of what? Aspiration. Okay? So the best answer number 27, Bravo. Probably kailangan na itong i-intubate. Okay? Best answer again in number 27, it's Bravo. Miss May, number 28, the nursing supervisor of ICU is not on duty when Nurse Gina committed a serious medication error. Which statement accurately reflects the accountability of the nursing supervisor? Best answer number 28, it's Charlie. The nursing supervisor on duty will notify Miss May at home. Best answer number 28, it's Charlie. Dapat tawagan talaga. Okay? If it's a serious matter. Okay. So 28, best answer, Charlie. 29, best answer, it's
Bravo.
avoid, no? Avoid should be,
B.
hindi makapagsalita yung mga guilty. It should be bravo, procrastination. Okay ha? Common na ano ng mga students. Okay lang yan. Nakaka-relate din ako. 29, best answer, bravo, procrastination. 30, best answer, it's Charlie. Charlie. 30, best answer, Charlie. Number 31, the main function of the patient's record is to do what? Best answer, it should be obviously it's Charlie. Vehicle for communication, Charlie. 31, Charlie. 32, ito alam ko marami sa inyo nalilito sa number 31 because all of these choices seem to be correct. So nurses, my tip for you, if you think that most of these choices are correct, always look for the item that encompasses the rest of the choices. This is what you call your umbrella effect. Look for the choice na parang all of the above. So the best answer really in your 31, the umbrella choice rather, it's your Charlie. Serve as a vehicle for communication. 31, Charlie. Yeah, test-taking strategy yan. Number 32, when Nurse Shane writes in the chart and discovers an error has been made, which is the best approach? Alpha, are you going to erase the erroneous material? Okay? So erasing erroneous material, is that legally acceptable? Is that legally acceptable? Erasing the erroneous material? No, yung technique natin dyan na yung guilty rin kayo during duty. Hindi makapagsalita kasi naka-monitor si Dean. Sino dito yung gumagamit ng yung mga tape natin, ha? As much as possible, do not use that method, okay? That is not legally acceptable, So eliminate alpha. Eliminate alpha. Number 32, eliminate alpha. Look at Bravo. Carefully ink out the erroneous material. So ibig sabihin ng ink out, you're going to crush out using your ballpoint pen, or maybe you're going to use your fountain pen, etc. just to cover up your erroneous entry. So that is not also what? That is not also advisable. Eliminate Bravo. So the best answer in number 32, according to Kosher and Herb, it should be delta. Draw a straight line through the error and initial it. Meaning na initial it, put your initials and your signature. Okay? Nakuha ba? Best answer number 32, it should be delta. Ayan. Number 33. Which of the following persons cannot have the access to the patient record? Okay ha? Keyword dito, cannot have the access to the patient record. Best answer in number 33, cannot have access, it should be the lawyer of the family. Very good. Siya lang yung hindi kasali sa healthcare team. Kailan lang siya mabibigyan ng access? When the lawyer will have a special power of attorney na nga, tapos bibigyan pa ng SPA, no? Tapos, if and when merong kailangan ng kailangan ng litigation o nagkakaroon ng kasuhan, pwede siya magkaroon ng access, okay, ng patient record only for legal cases. Okay, nakuha ba? Pag wala namang kaso-kaso, then dapat yung naka-access lang, it should be the members of the healthcare team and the patient himself. Best answer number 33, it's Bravo. 34, best answer, it's Bravo. 1, 2, and 5. 1, 2, and 5. Best answer number 34, it's Bravo. 35, best answer, Delta. 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 Saan na ba tayo? Number 36. 36. An example of a management function of a nurse is what? Is it alpha, teaching the patient to do breathing and coughing exercises? Is it a management function? It's more of an educator's function. Okay, ha? Parang health teaching yan. So eliminate alpha. Number 36, best answer. And then yung manager function. It should be your
Alpha, sir.
functions natin.
Yeah.
Remember your post DC. Ano ibig sabihin ng post DC? It's your planning, organizing, staffing. Ano yung D? Directing, and lastly, controlling. So alin dyan yung best answer number 36? Delta. Directing and evaluating the staff nurses. 36 best answer, Delta. 37. Head nurse in the unit believes that the staff nurses are not capable of decision making, so she makes the decision for everyone without consulting anybody. This type of leadership is called what? Is it alpha, laissez-faire leadership? Remember, if it's laissez-faire, it means leave me alone. So ibig sabihin, yung head nurse mo, papabayaan kayo because she believes that you are already experts in your practice. You do not need guidance anymore. That is your laissez-faire leadership. So eliminate alpha. Look at Bravo. Is it democratic leadership? Well, keyword, without consulting anybody. In fact, that is the complete opposite. So hindi yan democratic leadership. So the best answer in number 37, it should be autocratic leadership. Very good. Charlie. 37, it's Charlie. 37, Charlie. 38. The head nurse in your ward plots and approves your work schedules and directs your work. She is demonstrating what? Is it alpha, responsibility? Bravo. Delegation, Charlie, accountability, or delta, authority? Best answer in number 38. Siya yung nagpa-plot, it should be best answer, delta, authority. Okay, authority. 38, delta. The following task, number 39, can be safely delegated by a nurse to a non-nurse health worker except for what? Keyword, non-health nurse worker. Question, papayag ka ba non-health nurse worker? Siya ang mag-change ng IV infusions. Is that safe? No.
sir.
So the best answer is bravo, changing IV infusions. Okay? Number 40, giving the medication to a wrong client. You made that mistake. You notified the client's doctor and wrote an incident report. You are demonstrating what? Alpha, responsibility, Bravo, accountability, Charlie, authority, or Delta, autocracy. Pag sinabing inako mo yung kasalanan mo, it means you are demonstrating what? Accountability. It's Bravo, accountability. Okay, Joint Commission on Accreditation of Hospital Organization, or the JCAHO. Okay, now, 41. As head nurse in the OR, how can you improve the effectiveness of clinical alarm systems? Is it alpha, limit the suppliers to a few? Bravo, implement a regular inventory of supplies and equipment? Charlie, adherence to manufacturer's recommendation? Or Delta, implement a regular maintenance and testing of alarm systems? Best answer number 41, it's Delta, implement a regular maintenance and testing of alarm systems. Delta. Keyword dito is your clinical alarm systems. Ayan. That's why the best answer is Delta. 42, dosage of medication or anesthetic can happen even in the aid of technology like infusion pumps, sphygmomanometer, and similar devices / machines. As a staff, how can you improve the safety of using of the infusion pumps? Best answer in number 42, it's alpha. Check the functionality of the pump before use. What if kung tinanong specifically for sphygmomanometer, ano dapat yung gagawin mo? Ganito yung siya nurses ha, if you doubt the accuracy of your sphygmomanometer or your BP apparatus, have it checked by your technician. Usually, yung mga technicians sa hospital na tawag is the biomedical engineers. Meron tawag na biomedical engineers in the hospital. They're the ones responsible for recalibrating our diagnostic tools. For example, yung sphygmomanometer natin for vital signs taking. Okay, nakuha ba? Papacheck mo yan sa technicians sa hospital. So the best answer number 42, it's alpha. Recheck the functionality of the pump before use. 43, best answer, it's your Charlie. Take a video of the entire intraoperative procedure. Okay? Hindi yan kailangan. Okay? Hindi yan siya required. Best answer number 43, it's Charlie. Hindi kasali yan. Number 44, best answer, it's Charlie. Okay, Charlie. To reduce the risk of patient harm resulting from fall, you can implement the following except for what? Hindi nakakatulong yung Charlie. Allow the client to walk with a relative to the OR. Best answer number 44, it's Charlie. Kayo dapat yung mag-assist. Okay? Number 45, best answer. Number 45, it's Charlie. Call the client by his or her case or and bed number. Best answer number 45, Charlie. That is actually unsafe. Okay? Kaya just imagine, okay, bed 5. Tapos yung sumagot sa'yo na oo, yung bed 6. Okay? Kasi medyo bingi. Okay? Nakuha ninyo? So, kaya unsafe yung Charlie. Okay. Best answer number 45, that's Charlie. Number 46, which of the following research activities should you initially do? Ayan, sabi yung unahin dito. Best answer number 46, it's Charlie. Review the literature on the topic. 47, best answer, bravo, readability of the problem. Readability of finding. Number 48, best answer. A study or research should not contain which of the following? Should not contain is actually your, what? Number 48, to not violate the privacy, the anonymity of your subjects. You should not put the name of your sample. Okay? Best answer number 48, it's delta. Do not put the full name of your subjects. Pwede initials lang nila or codes. Okay? Codes, assigned codes. 48, best answer, delta. 49, which of the following actions will facilitate the analysis of research data? Is it alpha, consult a physician, bravo, consult an advisor, Charlie, consult a complete expert, or delta, categorize data collected? Best answer number 49 that will help you assist in your analysis, it's your delta, categorize the data collected. 50, research methodology that is appropriate for the above problem would be what? Best answer number 50, that's your Charlie, experimental method. Experimental method. Why experimental? Because it is actually the design wherein that's going to yield the most accurate results. It will establish the highest degree of causality. Yan yung best answer natin, Charlie, experimental. 51, knows that the drainage is 4 days, normal 4 days after sigmoid colostomy when the stool is what? Is it alpha, green liquid, bravo, solid form, Charlie, loose, bloody, or delta, semi-form? Best answer number 51, it's Charlie, loose and bloody. Okay, normal pa yan for the first 4 days. Number 52, where would Nurse Christine place the call light for a male client with a right-sided brain attack and left homonymous hemianopsia? Is it on alpha, the client's right side, bravo, left side, Charlie, directly in front of the client, or delta, where the client likes? Best answer number 52, it should be on the what?
Right side.
Very good. Right side. Kasi yan yung blinds, yan yung visible side niya. Asan yung blind spot niya? Di ba yung left side? Okay? So that's why you put your call light on the right side. Okay? Huwag niyong gagayahin yung ibang nurse na sasadyain na ilalayo yung call light para hindi makatawag yung patient. Huwag yung gagayahin yung ganun, ha? So the best answer number 52, it's alpha. Number 53, best answer. Number 53, ito ha. Admitted to the emergency room following an accident. What are the first nursing actions of the nurse? Diba ano nga yung ano natin? ABCs of life, airway, breathing,
Breathing, circulation.
circulation. So anong gagawin natin? Best answer, it should be your Charlie. Check the respiration, which includes your airway and breathing. Stabilize the spine, then check circulation. Best answer number 53, it's your Charlie. In some books, inuuna yung stabilize the spine before you check the respiration. It will depend on your source. Yung una ang spine, that is according to Schwartz, Principles of Surgery, and to Tintinallis, Principles of Emergency Medicine. Okay? Kay Brunner naman, focus lang siya sa ABCs of life. Nasa sayo na kung saan mo ilalagay yung stabilize the spine. Okay? Best answer number 53, it's Charlie. Do you guys read a lot of resources for your medical, for example, kung medical surgical, or focus kayo kay Brunner and Sudart? Nakafocus ba kayo kay Brunner and Sudart? Hello? Or hindi Brunner and Sudart yung nyo? Hindi Brunner and Sudart yung book nyo? Are you using Black and Hawks?
So,
Hello?
dati ako na mo, sir.
Brunner and Sudart. Nagtatanong ko kanina, hindi kayo sumasagot. Okay, so Brunner din pala kayo. Pero na-try niyong basahin si Black and Hawk?
Wala pa,
Wala pa, sir.
sir.
If I were to critique both of the books, I would say that Black and Hawks would be much more direct to the point compared to Brunner and Sudart. Si Brunner and Sudart, ang daming sinasabi. Okay? Mas worthy si Brunner and Sudart. Although, when we say more complete information, lamang talaga si Brunner and Sudart. But when you say for comprehension, student-friendly, Black and Hawk would really have the higher score. Pag sinabi mo for comprehension talaga. Easy comprehension for students. Sige, it's up to you which book you want to study. Nasa sayo niya. Okay? So number 54, best answer, that's your Delta. Delta. Guys, wag niyong kakalimutan na nitroglycerin can reduce preload by decreasing venous return through vasodilation delta. Okay, nakuha. Lumabas itong question na to in a June 2019 board exam. NP4 first page talaga. Lumabas. Wag niyong kakalimutan, ha? What's the action of your nitroglycerin? Ano na yun? Vasodilation. Reduces preload through decreasing of the venous return. Okay. Best answer number 54, it's Delta. Number 55. 55, best answer, it's Alpha. Call for help and note the time. Bakit kailangan nakanote yung time? Because we have a very short time frame for the patient to be able to become a candidate for what? For, tawag nito? Percutaneous coronary intervention or PCI. Yan yung pinapasok sila sa cath lab. Okay? So yan yung ginagawa pag MI. Okay? Best answer number 55, it's Alpha. Ang time frame natin nasa 30 minutes lang. That's why time is of the essence. You have to note the time. That's the most important thing pag may MI. Okay? So number 56, best answer number 56, it's Charlie. Take foods and medication at prescribed intervals to prevent what? To prevent drug-to-drug interactions. Ayan. Number 56, best answer, Charlie. 57, best answer, it should be 57, Bravo. Continue the treatment as ordered. 58, best answer, it's Bravo. In the operating room. 59, spinal anesthetic, best answer, number 59, is flat on back to prevent the leakage of what? CSF. Best answer number 59, Bravo, flat on back. Number 60, while monitoring a male client several hours after the motor vehicle accident, which assessment data suggests increasing intracranial pressure? Alin dyan yung nakikita natin sa Cushing's triad? Is it Alpha? Blood pressure decrease from 160 to 110. Is it Bravo? Increase from 87 to 95 with an occasional skip beat. Charlie, client is oriented when aroused from sleep and goes back to sleep immediately. Or Delta, the client refuses dinner because of anorexia. Saan dyan yung mga earliest sign of what? Of increasing intracranial pressure. It's your? What's your answer, nurses? Anong answer nyo?
Charlie.
Okay. So anong tawag sa Charlie? Pag ginising mo siya, tapos bigla namang natulog, hindi niya na-sustain yung wakefulness. Do you still call it drowsy? Do we still call it drowsy? For a while, nalobat na pala ako. Drowsy bang tawag doon? What should be the more accurate term? Sige nga. It should be, charge ko muna. Ayan. Okay. Yung if you're going to wake up the patient, and if the patient can sustain wakefulness, we call it drowsy. Okay? We call it drowsy. But if the patient, when aroused, then he or she cannot sustain a wakefulness, he or she goes back to sleep immediately, that is what we call lethargic. Okay? Lethargic patient. Nakuha? Pag nakasustain ng wakefulness, anong tawag? Sustained wakefulness.
Drowsy, sir.
Drowsy.
Drowsy. Nasustain niya. Ginising mo, nasustain niya, drowsy. Paano pag hindi niya nasustain? Yung pagising mo tapos natulog ka agad. Anong tawag? Lethargic, very good. So the best answer in number 60, it's Charlie. Remember earliest sign of increasing ICP is change in the level of consciousness. From drowsy, naging naging lethargic na. Okay? So number 61. Diagnosed with pneumonia, which of the following symptoms may appear first? Guys, ganito kung alin dyan yung mga pinaka less severe na symptom, yan usually yung first symptom or initially symptom. Okay? Initial symptoms or the earliest. Okay? Kung alin yung less severe, yan yung clue dyan sa number 61. That's why in the number 61, the best answer, it's actually alpha, altered mental status and dehydration. Ito pa. Usually, altered mental status and dehydration are also very common in elderly clients with pneumonia. Yan yung usually na nila na presentation. Very specific for elderly clients, yung alpha. Best answer, number 61, it's alpha. Number 62, best answer, it should be bravo. Ano yung very specific dito? Yung hemoptysis. Okay, hemoptysis. Best answer number 62, bravo. 63, ayan, emergency department, tachypneic, afebrile, respirate of 36. So, tachypneic talaga. Okay, napakabilis. And has a non-productive cough. Recently had a cold. From this history, the client may have which of the following conditions? Remember, afebrile, walang lagnat. Best answer, it could be what? 63. Best answer, acute asthma. Acute asthma. Pero pag nilagnat yan, you suspect for bronchial pneumonia. Pero since wala siyang lagnat, okay, the closest answer would be alpha, acute asthma. Automatic eliminate yung Charlie and Delta. Kabata-bata pa, may COPD ka agad. Ano yan? Smoker. At 7 years old. Just go. Okay. 63 best answer, it's alpha, acute asthma. 64. Nurse Marichu was given morphine sulfate for pain. She is sleeping and her respiratory rate is 4 breaths per minute. If action isn't taken quickly, she might have which of the following reactions? Okay, If action is not taken quickly, she might have which of the following reactions? Guys, ano yung side effect ng morphine sulfate? Anong side effect ng morphine sulfate? As an opioid analgesic. Ano yung effect niya? Diba? It should be respiratory depression or respiratory arrest. Bravo. 64, bravo. What is the antidote for morphine sulfate? Hello? Ano yung antidote natin for the morphine sulfate? Okay, it starts with the letter N. N. Okay, yung antidote natin is naloxone to be given at 0.5 ml every 5 minutes via what route? Intramuscular. Pero kung may IV access, you can give it via IV. Okay? Number 64, best answer, bravo. Ano nga yung antidote natin for morphine sulfate?
Naloxone.
Naloxone. Also known as what? Narcan. Narcan. Yung brand niya, Narcan. Okay. Number 65. 77-year-old male client is admitted for elective knee surgery. Physical examination reveals shallow respirations but no sign of respite distress. Which of the following is a normal physiologic change related to aging? Normal lang. So the best answer, number 65, it's delta, decreased vital capacity. Delta. Number 65, it's delta. Number 16, best answer, it's your Charlie. Presence of PVCs on the cardiac monitor. Best answer, number 66, Charlie. Number 67, best answer, it should be Bravo. Bravo. Sir, why avoid foods high in vitamin K? Because most probably this anticoagulant being used is what? Ano kaya yung anticoagulant? Yan yung clue ko sa inyo. Clue na yung vitamin K. Ano kayong ginagamit ng patient? The patient might be given what? Warfarin. Because remember, warfarin's antidote is vitamin K. Yung purpose ng anticoagulant natin na warfarin is to prevent the formation of clots. But the problem is if you are taking foods high in vitamin K, that would actually counteract the effects of your warfarin. Okay? And so the best answer in number 67, it's Bravo. Avoid foods high in vitamin K. Number 68, best answer. Number 68 should be Charlie, clipping the hair in the area. Number 69, best answer. Elderly female with osteoporosis. Ano nga yung major complication niya? Remember that osteoporosis is what type of disease? Ano yung problema sa osteoporosis natin? Decrease in what? Bone
Density.
density. Very good. So kung decrease yung bone density natin, it means that the bone is at risk for what? Bone fracture or alpha. Okay, alpha. Best answer number 69, it's alpha, bone fracture. Okay. Number 70, to perform BSE. The nurse should explain the purpose of performing the examination to discover what? Best answer number 70, it's Charlie. The most accurate answer is Charlie. Ito. Changes from the previous examination. Because hindi naman automatic na cancerous lumps yung mafe-feel mo. Any changes lang. Kaya you do your BSE monthly, okay, on the same day of each month. Okay? Best answer number 70, it's Charlie. Number 71. When caring for a female client who is being treated for hyperthyroidism, it is important to do what? Alpha, provide extra blankets. Remember, ang keyword natin, hyperthyroidism. Question, applicable ba extra blankets for hyperthyroidism to keep the client warm? Remember, pag hyperthyroid, ano siya? Heat intolerance or cold intolerance?
Heat, sir.
Heat intolerance.
Kasi masyado mataas yung metabolism niya. So lalo yan siyang maiirita pag dinagdagan mo yung blanket. So eliminate alpha. Bravo. Monitor for signs of restlessness, sweating, excessive weight loss during thyroid replacement therapy. Guys, keyword dito, look at this. Thyroid replacement therapy. Question. Kailangan ba ng thyroid replacement therapy pag hyperthyroidism? Di ba nanobra ka na nga ng thyroid hormones tapos dadagdagan mo pa ba? Ano kaya mangyayari sa patient? Will it result to what complication? It's called what type of storm? Thyroid storm. Pag dinagdagan mo pa yung thyroid hormones niya. So obviously, you should eliminate Bravo. The best answer here, it's actually Charlie. Balance the client's periods of activity and rest. Okay? Best answer, number 71, it's Charlie. There's no constipation in hyperthyroidism. Diarrhea nga yung problema nila. So the closest answer is Charlie, obviously. Ayan. So number 72, history of atherosclerosis. the risk of atherosclerosis. To decrease the risk, the nurse should encourage the client to do what? Best answer, number 72, bravo. Increase the activity level. Number 73, must log roll a client following what? Alin dyan yung surgery of the spine? Is it Alpha, Bravo, Charlie, or Delta? Yung dapat naka-straight lang yung katawan ng patient. It should be Alpha, laminectomy. Okay, that's the surgery of your spine. Okay. Best answer number 73, it's Alpha, laminectomy. 74, best answer, Delta. Avoid straining during bowel movement or bending at the waist. Delta. To prevent what? This will prevent increase in your intraocular pressure. Number 75, best answer, Delta. Delta, before age 20. Because testicular cancer commonly occurs in men between 20 and 30. Best answer, number 75, Delta. 77, best answer, it's your, joke lang. Number 76 pa pala tayo. 26 pa. Undergone a colon resection. While turning him, wound dehiscence and evisceration occurs. Ano ibig sabihin pag wound dehiscence? Na-reopen yung ano natin, yung operating site. For example, kung exploratory laparotomy, na-reopen yung incision sa gitna ng abdomen. Pag sinabi namang evisceration, ang ibig sabihin yan, okay? Ang ibig sabihin yan, yung evisceration, yung bowel natin na expose. Okay? Yung bowel. So small intestine and your colon are exposed. So the first response is to do what? Is it to call a physician? Bravo. Take the blood pressure and pulse. Place a saline soaked sterile dressing on the wound, or Delta. Pull the wound dehiscence close. Best answer, number 26. It should number 76 rather. It's Charlie. Place a saline soaked sterile dressing on the wound. But nurses, let me ask you. Ganito. What if ang choice nyo between place a saline soaked sterile dressing on the wound or elevate the head of bed? Alin yung uunahin nyo? Repositioning or covering the wound? You should do first your repositioning. Then saka nyo gagawin yung covering ng wound. Okay, nakuha? But in this case, since walang repositioning dito, the best answer, number 76, it's Charlie. Number 77. Okay, nurses, please read this type of respiration. Paki-read na itong ano na to, respiration.
Chain stroke.
Chain stroke
Respiration.
Readin nga. Chain strokes. Ano yon?
Chain stroke.
Chain stroke
Okay.
respiration.
Ito ha. Repeat after me. Wala yan siyang strokes dapat. Dapat ano yun siya. Sige lang. Di ko ma-erase. Repeat after me. Kind-Stokes respiration. Repeat after me. Kind-Stokes respiration. Kayo nga.
Kind-Stokes respiration.
Kind-Stokes ay na. Kind-Stokes. Very good. It's Kind-Stokes ha. Wala na ako maririnig na chain na yan. Okay? So the best answer, number 77. Ano pala yung Kind-Stokes? Ganito yan. Bumibilis, humihina, tapos merong periods of apnea. Best answer, number 77, it's your alpha. Okay? Progressively deeper breaths followed by shallower breaths with apneic episodes. Best answer, number 77, it's alpha. Number 78. Nurse Bea is assessing a male client with heart failure. The breath sounds commonly auscultated in clients with heart failure are what? Is it tracheal, fine crackles, coarse crackles, or friction rubs? Best answer, number 78, it's what? Ano? Best answer dito, it's your bravo, fine crackles. Fine crackles. Fine crackles. Bakit fine crackles? Because your fluids are localized in your alveoli. Okay? Pag coarse crackles naman, yung secretions, doon siya naririnig pag coarse crackles siya kapag yung secretions mo nasa airways mo, yung bigger airways, the trachea, the bronchi, etc. Pero pag nandoon naman sa smaller airways mo, yung mga alveoli, it's fine crackles yung result. So in heart failure, yung mga secretions natin, nandoon siya sa alveoli usually. Okay? Pag nakakaroon ng left-sided heart failure. Kaya the best answer in number 78, it's bravo, fine crackles. Number 79, best answer, it's your bravo, bravo. Number 80. Number 80, best answer, delta. Delta. Number 81, best answer. Number 81, best answer, bravo. Bravo. Maka na-block lang yung chest tube niya. Kaya nagkaroon ng tension pneumothorax. Number 82, best answer, delta. Delta. Kasi nakakapag-cough pa siya. That can help, okay? That can help remove the foreign object. Pero pag wala ng cough, hindi na makapagsalita, that's the time you do the Heimlich maneuver. Okay? Nakuha? Best answer number 32, it's delta. Number 83, best answer, it's your bravo. Current health promotion activities. 84, best answer, it should be Charlie. 84, Charlie. 85, best answer, Charlie, pneumonia. Take note of what? Fever, okay? Change in mental status and diagnosis of dehydration. Kasi sabi ko lang kanina, very common yung dehydration and change in mental status in elderly clients. Like look at that age, 77. That's why the best answer, it's actually pneumonia, Charlie. Number 86, best answer, Charlie. 43-year-old homeless man with a history of alcoholism. Number 86, best answer, Charlie. Number 87, with a positive Manto test, okay, will be sent for chest x-ray. The nurse is aware that which of the following reasons this is done. Is it alpha, to confirm the diagnosis? Bravo, to determine if the repeat skin test is needed. Charlie, to determine the extent of lesions. Or delta, to determine if this is a primary or secondary infection. Best answer in number 87, it's Charlie, to determine the extent of lesions. It's not a confirmatory test. Bakit hindi siya tinatawag na confirmatory test? It's because most of the Filipinos nowadays in the Philippines are already carriers of the pulmonary tuberculosis na microorganism. And ano yung causative agent niya? Ano yung causative agent? Mycobacterium tuberculosis. Okay? So hindi siya makakonfirm kasi most of us would test positive already. Okay? Pero bakit hindi tayo nagkakasakit? It's because we are vaccinated against PTB. Okay? PTB. Ano yung tawag sa vaccination natin against PTB? Anong tawag sa vaccine na yun? It's your BCG. What do you mean by BCG, nurses? Very basic. It's your Bacillus calmette-guerin vaccine. Okay ha? Bacillus calmette-guerin vaccine. Number 88, best answer, it's your bronchodilators. Bravo. Bronchodilators. 89, best answer, Charlie, chronic obstructive bronchitis. Number 90, best answer, it's alpha, under local anesthesia during the procedure. Remember ha, napakasakit niyang bone marrow transplantation. Okay? Ang best answer niyan, it's actually alpha, hindi siya local anesthesia. Number 91, best answer, it's your delta, raise the side rails to promote safety. 92, best answer, it's your crowd. It will crowd your red blood cells, hence leading to anemia. Okay? Best answer number 92, it's alpha. 93, best answer, it's your leukocytosis. Bravo. 94, best answer, alpha. Explain the risks of not having the surgery. Number 95, best answer. That's your delta. Delta. Number 96, best answer. It's your Charlie, cocaine. Cocaine. Bakit cocaine? Kasi among these different medication, siya lang yung makakakos ng stimulatory effect. Remember, ang keyword natin, racing out of the chest. Masyadong mabilis yung heart rate niya. So the only possible drug that can cause that based on the choices would be your cocaine, Charlie. Obviously, Charlie. 97. Best answer. That's your Bravo, non-mobile mass with irregular edges. Okay ha? Pag irregular, always suspect cancer. No? Suspect cancer already. Pag irregular yung borders niya. 98, best answer. That's your Charlie, radiation. Radiation. 98, radiation. Number 99, best answer. 99, best answer. It's Bravo. Carcinoma in situ. Okay? Carcinoma in situ. It means na hindi pa siya nag-metastasize. Yan yung meaning niya. Yan yung meaning ng TIS, no lymph nodes involvement and no metastasis. Okay? Best answer number 99, it's Bravo. Familiar na ba kayo sa TNM system, nurses? Are you familiar with the TNM system? Hello?
Wala pa, sir.
Yes, sir.
Okay. I would understand kung bakit hindi kayo familiar because your TNM system is usually not it's usually not taught in nursing school. That's because your TNM system is usually studied by medical students. Outside na yan sa scope of practice natin as nurses to interpret the TNM classification. Okay? So dinagdag lang itong question na to dito so that you will have an idea just in case the Board of Nursing is going to ask this type of question. But I don't think that the Board of Nursing is going to include this in the actual board exam. Kasi ang Board of Nursing natin, magfo-focus na sila sa scope of nursing practice. Okay? So at least meron kayong idea kung ano yung TNM system. For the TNM system, T means tumor size, N means lymph node involvement, and M means metastasis. There's no need for you to memorize everything in the TNM because take note, yung TNM natin, nakadepende yan sa type of cancer. Each type of cancer have their own TNM system and they have their own staging. Kaya napakasakit yan sa ulo. Okay? Hindi na yan siya kasali sa scope of nursing practice. Remember that. Okay? So the best answer number 99, it's Bravo. How about in number 50? 100 rather. Lydia undergoes laryngectomy to treat laryngeal cancer. When teaching the client how to care for the next stoma, the nurse should include which instruction? Best answer dito, number 100, is to delta. Keep the stoma moist. Okay? Keep the stoma moist. 100, best answer, delta. 101, best answer, it's Bravo. Assessing the client. Based on ano nga to? Ano yung basis natin kung bakit Bravo? Assessment, it's your NPI. Always do your assessment first. 101, best answer, Bravo. 102, best answer, it's your delta. Encouraging gentle range of motion exercises after administering aspirin before rising. 102, best answer, delta. Number 103, best answer, it's your delta. Left foot cold to touch, no palpable pedal pulse. Okay? Guys, what do you call this condition? Possible that the client has developed what? What syndrome? It starts with the letter C. O. Ano yan? Compartment syndrome. Okay Compartment syndrome. What are the 6 P's of compartment syndrome? Pakinote. Ha? I-note nyo ito ha. Very important. Compartment syndrome, 6 P's. Una, there is pain very severe. Pain very severe. There is presence of paresthesia. Paresthesia. There is also pallor. 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 Another P would be pulselessness. Pulselessness. Next would be paralysis. Paralysis. Then the last P would be poikilothermia. Poikilothermia. Poikilothermia means cold to touch. Nakuha ba yung 6 P's natin? Nakanote ba? What are the 6 P's again of compartment syndrome?
Pain very
Pain very
severe,
severe,
paresthesia, pallor, restlessness,
paralysis, and
Hypothermia.
poikilothermia.
Okay? If you observe these different signs of compartment syndrome, okay, this is actually very dangerous. Why? Bakit siya tinatawag na dangerous? Because in your compartment syndrome, ganito kasi nangyari. This is your extremity. You have a fractured leg, okay, a fractured extremity, okay? Kung may injury ba, will there be inflammation? Pag may injury, di ba? Merong inflammation. Now, the inflammation can become severe to the point that the swelling can cause, okay, can cause pressure, okay? It can put pressure on your blood vessels, causing decreased perfusion to your extremity. Nawawalan na ng blood supply yung extremity mo. Okay? Again ha, going back to compartment syndrome, it can happen after an injury of your extremity resulting to severe inflammation wherein the swelling, okay, the severe swelling can put pressure on your blood vessels causing or disrupting the blood supply towards your extremity. Hence, meron tayong non-palpable pulse. Kaya yan yung nangyayari. Okay? Pag napabayaan yung compartment syndrome, it can actually result to the amputation of that affected extremity. Now, what do you call that emergency procedure wherein you're going to do an incision on your muscle in order to remove the muscle? In order to relieve the pressure. Okay? Sino yung mag-incise? Yung doctor. Ang role lang ng nurse dito is to assist in the procedure. Anong tawag sa procedure na yon? To make an incision on the muscle in order to relieve the pressure. What do you call that? That is what you call your fasciotomy. 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 Pakinote. Again, anong tawag sa procedure na yon to relieve pressure in your compartment syndrome?
Fasciotomy.
Fasciotomy, very good. Okay. Ganun lang, magsaslice lang yung doctor dyan para hindi lang siya para hindi na maput yung pressure doon sa artery involved. Okay? Sige. Number 104. Which term would Nurse Dolor use to document at one site that is perceived in another site? Ang keyword, pain at one site pero perceived in another site. What do you call that? It is what you call your referred pain. 104 is alpha. Best answer number 104, it's alpha. 105, best answer, it's Charlie. Charlie. Nurses, matanong ko, are you learning something new today?
Yes,
Yes,
sir.
sir.
Yes, sir.
Natutunan kayo so far? Are you able to follow through the additional inputs? Nakapag-note ba kayo?
Yes, sir.
Okay, very good. Please take note. Kung may mga additional inputs ako, please take note because those inputs are actually common board questions. Okay? Common board questions yun. And napaka-importante din yun sa scope of practice nyo once you become registered nurses in the future. Okay? Sige. Number 106. To decrease the size and vascularity of the thyroid gland prior to thyroidectomy, the nurse would expect the physician to order what medication? Alin dyan? Best answer, it's actually potassium iodide. Okay? Because it can exert a negative feedback on the thyroid tissue, decreasing its metabolism and vascularity. Okay, ha? Best answer, it's Charlie, potassium iodide. Sir, why not propyl thiouracil? Kasi yung action lang ng propylthiouracil, okay, it's to decrease the level of your thyroid hormones. Okay? Hindi siya makakatulong sa decreasing ng size ng thyroid gland. Pag immediately kasi before thyroidectomy, ang best talaga na medication, it should be your potassium iodide. Charlie. 106 best answer, Charlie. 107. Immediately after thyroidectomy, Mr. Gray should be monitored for what? Alpha, decreasing blood pressure. Bravo, urinary retention. Charlie, signs of restlessness. Or Delta, signs of respiratory obstruction. Ano nga yung priority natin based on the ABCs of life? It should be number 107. Kung based on the ABCs of life.
Airways.
Ano yun?
Airways.
Airway. So, dapat ang best answer is Delta. Respiratory obstruction. Sir, bakit respiratory obstruction? Ang kalayo-layo, problema niya, thyroidectomy. Bakit magkakaroon ng respiratory obstruction? Question. When doing thyroidectomy, what's the other gland that can be accidentally removed during the procedure? Anong gland yun? Nasa likod lang siya ng thyroid. Kapangalan lang niya yung thyroid. Nasa likod lang siya. Anong tawag doon?
Parotid, sir.
Ha?
Parotid.
It's not your parotid gland, ha? To clarify, your parotid gland is located in your submandibular area. It is concerned with producing what? Saliva. Yan yung parotid gland. Yung nasa likod ng thyroid gland natin, ang tawag doon is parathyroid gland. Okay, ano nga yung glands nasa likod ng thyroid gland? Parathyroid. Now remember that your parathyroid gland releases what hormone? Parathyroid hormone. Your parathyroid hormone is the hormone that will increase the level of calcium inside your blood. Okay? Now, pag wala ka ng parathyroid gland, na-remove siya during the thyroidectomy, ano mangyayari sa calcium level mo? Will it increase or decrease?
Decrease.
Decrease. Very good. Kasi wala ka ng parathyroid gland. Now, pag nag-decrease na yung calcium level, ano ang tawag sa condition na yun?
Kalimia.
Calcemia. Yung kalimia, potassium yun, ha? Calcemia. Very good. Hypocalcemia. Now, what are the signs of hypocalcemia? Now, remember, pag hypocalcemia, are you at risk for spasms? Yes, you are. Kaya, posibleng magkaroon ng respiratory obstruction post-thyroidectomy because of hypocalcemia. Now, what do you call this specific sign ng hypocalcemia? Ito, ano tawag dito? Ano tawag dito? Yung pag nag-tap ka dito sa sa cheeks mo, magkakaroon ka ng ganitong spasm. What do you call that? There is a specific sign of your hypocalcemia. Ano 'yan? Sige. Iano ko ha. Pwede ko i-type ko dito ha, basahin nyo. Sige. Everybody read this sign. Ay, hindi. Wrong spelling pala yan. Sorry. Ayan. Pakiread nga. Pakibasa. Na-chat ko na. Yung spelling. Hello? Sige, basahin nyo. Sige.
Escobotic sign.
Okay. Ganito ha. Para hindi kayo mahirapan, it's actually called your Vostek sign. Repeat after me. Vostek sign. Very good. Vostek sign. Okay, galing. Yan yung Vostek sign ganito. Nakikita niyo yung screen ko? Yung yung video, yung ko? Yung mukha ko, di ba?
Yes, sir.
Ko ganun. Yan yung Vostek sign. So, hindi yan sa baka feeling nyo, nagkagusto yung pasyente sa inyo. No, hindi yan ha. Baka Vostek sign lang yon. Ano naman pag nag-beep, tapos nagpasan yung arm, anong tawag doon? It's your trousseau sign. Okay? Also known as your carpopedal spasm. Sige, let's proceed. 100, ano na tayo? 108 na. Medyo bibo yung ano natin, no? 101 Dalmatians natin. Napaka-excited nila. Sige. 108. 108 na tayo. Yes. 108. Following thyroidectomy, possible laryngeal nerve injury. Should do which of the following on an hourly basis? Best answer, it's your alpha. Ask the client to speak. Okay? Ask the client to speak. 109. Best answer. Removal of the parathyroid glands during thyroidectomy would cause what? Best answer dito, asan dyan yung may seizure? Seizure, it's your tetany, alpha, tetany, tetany. 109, best answer, tetany. 110, best answer, Charlie. Charlie. 110, Charlie. 111, best answer, Bravo. Bravo. 112, best answer, Delta. Artificial larynx will make me sound sort of monotone. 113. 113, best answer, Delta. 113, Delta. Immediate post-op management, Delta. Remember, ano nga yung priority natin? ABCs of life. So, a priority ang airway. So, di ba? Pag alam niyo lang yung ABCs of life, marami na kayo masasagutan. Okay? So, 114, best answer, Charlie. All types of water sports. 115, best answer, Delta. I will need to use humidifier in my home. 116, best answer, Alpha. Withhold the drug until additional orders are obtained from the physician. 117, best answer, Delta. I will have Micah use his medication to prevent asthma attacks. Ano ba to? Ang sunod, number 118, best answer, it's Charlie. Inhale completely, then blow out as hard as and as fast as possible through the mouthpiece. Ayan. 118, best answer, Charlie. 119, Micah is scheduled for surgery. Pre-operative teaching should include the fact that the client is what? Okay. Ang dapat nakasali dito, 119 should be alpha. Prone to respiratory tract infections. 120, priority goal for Micah, who is being discharged from the hospital, is what? Alpha, obtain pulse ox readings. Bravo, demonstrate the use of meter dose inhaler. Charlie, knows that the primary care provider's office hours. Or Delta, identify foods that may cause wheezing. Best answer, dapat marunong gumamit ng inhaler. Guys, in patients with chronic bronchial asthma, the most important thing is that they're able to maintain their medication effectively. Okay, dapat proper yung administration, consistent and compliant sila sa medication regimen. That's the best way to manage chronic bronchial asthma. Okay? Best answer in 120, that's your Bravo. 121, best answer, it's Bravo. Residual capacity of the lungs has been increased. 122, 2 liters per minute via nasal cannula to L. The nurse should observe the client closely for what? Is it cyanosis or letter G, anxiety and tachycardia, hyperemia and decreased respiration, or drowsiness and decreased respiration? Guys, di ba pag may COPD, what is the type of respiratory drive? Is it hypercapnic or hypoxemic drive? Sige. Anong drive nila pag COPD? Pag may COPD, normally, yes, go. What's your answer? Hypercapnic or hypoxemic? Pag COPD. It's actually your... Okay, ganito yan. Kapag may patient ka with COPD, okay, the respiratory drive is hypoxic drive or hypoxemic drive. Ganito kasi yan. Normally, when you do not have any disease, normal yung lungs mo, we are naturally hypercapnic breathers. Meaning, we are stimulated to breathe to breathe because of increased carbon dioxide in our body. Pag tumataas again yung carbon dioxide, we are stimulated to breathe in order to remove this excess carbon dioxide. But what happened in COPD is that instead of being hypercapnic breathers, they become hypoxic breathers, meaning the only way for them to be able to breathe is that they have a low concentration of oxygen. That is the reason why in 122, you have to monitor for delta, drowsiness and decreased respiration. It's because if you have an increased level of oxygen in COPD, that can lead to respiratory depression. Best answer number 122, that's your delta. Nakuha ninyo? Nakuha ba?
Yes, sir.
Yes, sir.
Yes, sir.
Clear. Is it clear bakit delta?
Yes,
Ano nga
Yes, sir.
what's the drive of respiration pag COPD?
Hypoxic drive.
sir.
Hypoxic drive, very good. Paano naman kapag normal lang, normal person? What's the respiratory drive?
Hypercapnic drive, sir.
Hypercapnic drive, very good. Sige. 123 na tayo. 123. In 123, the best answer it's actually Charlie. The rupture of a subpleural bleb. Okay? Probable cause yan ng spontaneous pneumothorax. Ganito kasi yan. Bakit na rupture yung bakit siya nagkakaroon ng pneumothorax? Pneumothorax is defined as the presence of air in the thoracic cavity. Bakit nagkaroon ng pneumothorax spontaneous is because pag na-rupture yung part ng lung mo, so ano mangyayari dyan? May makakapasok na hangin doon sa thoracic cavity when in fact dapat wala. Okay? So the best answer number 123, it's your Charlie. Sir, bakit hindi delta? The puncture wound of the chest wall. It cannot cause, hindi siya spontaneous pneumothorax ang tawag dyan. Ang tawag dyan is your pneumothorax secondary to your injury. So, ang nangyari dyan sa puncture wound ng chest wall, ano mangyayari? Ang tawag, aside from being called as your pneumothorax secondary to injury, it can actually cause your sucking chest wound. Yan yung delta. Okay? Sucking chest wound. Pag na-open yung chest wall mo. Kaya yung best answer dito, pag sinabing spontaneous, wala siyang injury sa chest wall. So, ang best answer dyan, yung injury mo nasa loob. That's your Charlie. The rupture of a subpleural bleb. 123, best answer, it's your Charlie. 124, best answer, Charlie. Give oxygen 2 liters per minute via nasal cannula. (125) best answer, it's your Charlie. Greater negative pressure within the chest cavity. 126, best answer, alpha, associated with the destruction of beta cells. Also known as what? Islets of, na-mention ko to kanina. Islet of Langerhans. Ano nga yun yung beta cells? Ano yun?
Islet of Langerhans.
Islets of Langerhans. Very good. Alpha. 126, alpha. 127, best answer, it's delta. Delta. May I ask, ano yung usual ninyo na practice during lecture? Do you have traditional lectures or you do lectures in general lecture lang ng CI and then you're going to do reporting on the different diseases? I'm curious. Anong nyo? Anong practice ninyo? Usually sa school. Do you do reportings?
Yes, sir.
So majority of the time nagre-reporting kayo for medical surgical nursing or majority ng traditional lecture by the clinical instructor? Ano? Or so-so lang? Minsan reporting, minsan equal lang?
Equal lang, sir.
Walang. Okay, sige. Pero saan yung mas nyo? Kayo personally as student, saan yung mas feel na may natutunan kayo? When you do active learning through reporting or through lectures na pure? Saan nyo mas prefer?
Lectures na pure, sir, na face-to-face.
Na face-to-face, yes. I understand, no? That is one of the challenges talaga pag online. Bakit? Alam niyo bakit? Challenging siya for the student kasi nahihirapan niya i-keep up yung attention span. Challenging din siya for the lecturer kasi hindi niya nakikita sa students niya kung naiintindihan ba yung lecture niya. Tama ba? No, yan din yung struggle ng lecturers. Di kasi nakita kung kumukunot na ba yung mukha ng mga students, ganito, ganyan. Di ba? Ang dami talagang barriers in the during the lectures online, no? So if I were you talaga, you have to maximize your time during duties. No, learn as much as you can during your duties kasi yan lang yung face-to-face ninyo. Okay? Always try to experience every procedure. Kung may mga procedures kayo, volunteer kayo. Okay? Kasi don't worry, kasi your CIs are there to guide you naman, no? Kung nandiyan din yung mga staff nurses na very friendly. Okay? Learn as much as you can kasi wala tayong magagawa kung may online classes. It's because we want to prioritize the safety of the students. Nakuha ba ninyo? So kung yung may
Yes, sir.
Yes, sir.
doon kayo bumawi. Okay? Yung sa experience nyo. Kung meron kayong diabetic client, learn about diabetes in actual, no? Ganun yung natin. That's how we are able to adapt to this pandemic, no? Kailangan na nating mag-adjust. Ayan, no? Ika nga. So kayang-kaya yan. Kayang-kaya?
Walang duda.
Walang duda.
Walang duda?
Kayang-kaya.
Okay, sige. Let's continue. 127, best answer, Delta. 128, best answer, Bravo. Increase dietary intake when there is a plan to exercise more than usual. Okay? Ano na tayo? Number 129, best answer, 129, best answer. 128 pa pala, sorry. Yung 128, 127, it's Delta. Delta pala, 127 Delta. Yung 128 should be Bravo. Okay, Bravo. Pag 129 naman, 129, it should be your Delta. Okay? Now, saan mas common ang diabetic ketoacidosis? Is it in type 1 DM or type 2 DM? Saan mas common ang diabetic ketoacidosis? It's actually more common in type 1 DM. Yung sa type 2 DM kasi, ang common na disease dyan, pag hindi uncontrolled talaga yung sugar, it will result in HHNS. Are you familiar with HHNS? It's actually your hyperglycemic, hyperosmotic, non-ketotic, okay? HHNS, non-ketotic syndrome. Yan yung HHNS. Again, ano ibig sabihin ng HHNS? Hyperosmotic, hyperglycemic, non-ketotic syndrome. Depending on the literature, na-interchange yung hyperglycemic and your hyperosmotic. So depende kung anong book yung binabasa nyo. Okay? Yung HHNS, common yan siya in uncontrolled DM type 2. Pag DM nga, ano yung common pag DM? DM type 1 rather. Pag DM type 1, anong common? DKA or HHNS?
HSNS.
Uy, yung ano? No. Type 1 DM.
Ketoacidosis.
Type 1.
DKA, sir.
DKA. Pag type 2, ano yung mas common?
HHNS.
Okay, very good. Okay, you can review that in Brunner and Sudart on the chapter on endocrine dysfunctions under diabetes mellitus. Diyan, meron siyang diyan explanation. Meron din siyang table niyan, okay? So when you're going to study Brunner and Sudart, I suggest that you study the tables, the diagrams, and the side notes. Okay? Pag medyo nakakapagod na basa yung paragraph. Kasi usually nandun yung mga high yield na mga information. Okay? Suggestion ko lang sa inyo. So 129, best answer, Delta. 130, best answer, Bravo. Okay? Excess accumulation of ketones from rapid fat breakdown causing the acidosis. Kaya nangyayari yung diabetic coma. Very important talaga, nakokontrol yung sugar, especially ng mga type 1 DM. Pag hindi kasi na-control niyan, question, yung sugars ng type 1 DM, will it be absorbed by your body effectively pag walang insulin? Na-absorb ba? Pag walang insulin, na-absorb ba? Yes or no?
No, sir.
No, very good. Hindi siya na-absorb. Very good. Now, since the body cannot get its energy from the sugars, saan siya kukuha ng energy? Saan? Fats. Very good. That's the pathophysiology of your diabetic ketoacidosis. Nakuha ninyo. Kaya nagkakaroon ng ketoacidosis. Kasi may increased formation of ketones from rapid fat breakdown. Okay, nakuha ninyo? Naintindihan ba?
Sir.
Okay, very good. 130, best answer, bravo. 131. Important laboratory test for confirming the diagnosis of hyperosmolar hyperglycemic non-ketotic syndrome. It's your best answer dito sa 131. It's your delta, serum osmolarity. Okay, na-mention na yan kanina. 'Di ba? Dito, has type 2 diabetes. Kasasabi ko lang kanina, wag yung nagpalibak ang HHMS. Okay? 132. Admitted with hyperosmolar hyperglycemic non-ketotic syndrome. Nurse Muhinder's priority is to provide what? Remember, masyadong mataas yung sugar. Ano kaya yung classic signs ng diabetes mellitus? Ano yung three P's ng diabetes mellitus? It's your 3 P's: polyuria, polyphagia, and your polydipsia. Okay? Bakit may polyphagia? Polyphagia kasi gutom ka na gutom kasi hindi na-absorb ng katawan yung sugar. Bakit nagkakaroon ng polyuria? Polyuria in order to excrete the excess amount of sugars through your urine. Doon mo nilalabas. Kaya during polyuria, meron ding glycosuria. Next, bakit nagkakaroon ng polydipsia or sobrang uhaw? Kasi ihi ng ihi, nagkakaroon ng dehydration. So based on that knowledge, what's the best answer in 132? What should be the priority?
Fluid
Fluid
replacement.
replacement. Very good. Charlie. Fluid replacement. Charlie. Ayan. 133, best answer, it's actually alpha. Alpha. Masyadong sobra na yung 6 liters. Maawa kayo sa pasyente. 133, best answer, alpha. 134, best answer, it's alpha. 134, alpha. 135, best answer, delta. 135, best answer, delta. 136, best answer, delta. 136, delta. 137, what is the cause of Cushing syndrome? Okay, common cause. It's your what? 137, it's Charlie. Charlie. Okay, hyperplasia of the adrenal cortex. 138, best answer, delta. Delta. 139, best answer, it's delta. Delta. 140, best answer, it's alpha, hypocortisolism. Bakit? Kasi pag natanggal na yung pituitary gland niya, wala na mag-stimulate sa release ng cortisol. That's why you have to watch out for hypocortisolism. Pag walang hypocortisolism, you look for hypopituitarism. Okay? Best answer in 140, it's alpha. Guys, are you familiar with Cushing syndrome? Familiar?
Yes, sir.
Okay. So in Cushing syndrome, what are the characteristic signs? Yung bilog ang muka. Anong tawag doon? Sige. Ganito ha. Are you familiar with the term moon face in Cushing syndrome? Moon face. Bakit siya tinawag na moon face? Sir, bakit moon face? Yung mukha ba ng patient parang moon? Na half moon? Hindi. Ha? Iba, hindi siya crescent moon ha. Dapat siya full moon. Kaya siya tinawag na moon face. Okay? Parang full moon. Bilog na bilog yung mukha niya. Okay? That's one sign of your Cushing syndrome. Aside from the moon face, meron din tinatawag na buffalo hump. Buffalo hump. Meron din tayong obesity in Cushing syndrome. and very thin extremity. Sir, bakit ganun yung mga mga presentation niya? It's because it's attributed to the increase in the production of your stress hormone called what? Cortisol. Okay? Cortisol. Kaya watch out for hypertension and hyperglycemia in these types of patient. Nakuha? Hello?
Yes, sir.
Yes, sir.
Klaro yan ha, klaro. Sige, next. 141. Ano yung opposite naman ni Cushing syndrome wherein decrease yung level of cortisol? It's your Addison's disease. Okay? Addison's disease. Best answer in number 141. 141, best answer, Charlie. Shock may be developing. Ang tawag sa shock pag merong Addison's disease, it's actually your endocrine shock. Okay? Endocrine shock. 141, best answer, Charlie. 140, 142, hypotension associated with Addison's involves the disturbance in the production of what? It's your mineralocorticoids, delta. Nadamay din yung aldosterone natin. Kaya hindi na siya maka-adapt to the sudden changes in your blood levels. Okay? Best answer in 142, delta. 143, best answer, delta. Extra salt is needed. Okay? Kasi kulang na siya ng aldosterone. Question, what part of the adrenal gland is aldosterone being released? What part? Is it in the adrenal cortex or adrenal medulla? Ang aldosterone. Saang part? Medulla or cortex?
Cortex, sir.
Very good. Cortex, ha? Cortex yung aldosterone or mineralocorticoid. But next question. Which part of the adrenal cortex? What layer? It's your best answer is zona glomerulosa. Okay, in that part. Paano naman yung cortisol? What part of your adrenal gland? Cortex or medulla? Yung cortisol.
Medalla mo, sir.
Ala! Okay, ganito yan ha. Para hindi kayo mawala. Your cortisol is also released in the adrenal cortex. Yung mga hormones na nare-release ng adrenal medulla, it's your epinephrine and norepinephrine. Nakuha ninyo? Nakuha? Klaro-klaro ba?
Yes, sir.
Okay, very good. Okay? Guys, ang ano ko sa inyo ha, if you want to maximize your learning, no? Always participate when someone is asking question. Huwag na kayong matakot kung mali yung answer nyo. Huwag matakot. Kasi mas gusto ko pa yan pag may narinig akong yung student ko sumasagot. Kung mali, then we correct. At least you are learning. Okay? Huwag kayong matakot. That's the very reason why we have this lecture, why we have this rationalization. In order for us to learn from our mistakes. Okay? Huwag kayong mahiya. Hindi naman kayo papagalitan. Okay? Pero very good ha. Dapat nyo tandaan, pag medulla, what hormones ang nire-release lang?
Epinephrine and norepinephrine.
Very good. Sa adrenal cortex naman, ano yung nire-release?
Aldosterone and cortisol.
Aldosterone and cortisol. Very good, very good, very good, very good. Okay. Best answer in 142, it's delta. 143, best answer, delta. 44, 144. 144, best answer, it's your alpha. I should avoid strenuous exercise during hot weather. Remember, wala na siyang stress hormone. So, kaya pa ba niyang mag-adapt sa stress? Hindi na, ha? So, best answer in 144, it's alpha. 145, best answer for lifelong therapy, it's your bravo. Lifelong therapy na. Okay? Maintenance ng cortisol yan. 145, best answer, it's your bravo. 146. Best answer, it's your delta, urine output of 20 to 30 ml. Bakit siya i-report? Normal ba yung 20 to 30? Di ba dapat ang normal natin is 30 and above? Okay? That's why the best answer, it's delta 146. So 146. 147. Best answer, Alpha, recording the findings. 148, best answer. It's your 148, it's Bravo. Apply direct pressure to prevent further hemorrhage. 149, best answer, Delta, providing cleansing enemas and laxatives as ordered. Last number, 150, best answer, it's Alpha. Turn the client to observe the dressings. Okay? So ayan. So congratulations for finishing the pre-test of Peak Excellence Review Center. So kamusta ang scores natin? Okay lang yan, ha? Guys, walang problema yan sa pretest. Ang importante sa pretest, you're able to have an idea of your baseline performance. As you go along with your review, there will be an increase in your, or improvement in your performance. For as long as you study diligently, for as long as you continue to practice answering different types of exams, etc. Okay? So kayang-kaya?
Walang duda.
Walang duda.
Kayang-kaya.
Papasa sa board exam.
Papasa.
Repeat after me. Papasa sa board exam. Again, repeat after me. Papasa sa board exam.
Papasa sa
Papasa sa
board
board
exam.
exam.
Magta-top sa board exam.
Magtatap sa board exam.
Okay, very good. So everybody, grab your license. Ganito lang, pag-grab. Woo! Yan. Kayo nga, grab your license. Ayan. So, thank you so much, Lord's College, and thank you so much to Dean, no, for giving me the opportunity to teach the students and for making this event possible during Sunday. So enjoy the rest of the day and submit your scores to our coordinator, Ma'am Trisha, or kung sino ba yung na-instruct sa inyo na i-send nyo. Okay? So thank you so much, nurses. So see you when I see you. And so hopefully I'll see your names in the the list of board exam passers in the future. So congratulations and have a good day. Bye-bye.
Yes,
Sir.
sir.
So ay wait lang pula, baka mayroon pang additional announcement si Ma'am Trisha. So wait lang muna tayo ah. Ma'am Trish, are you there? We're done with the rationalization na po. Hello.